Mm. Hello, everyone. Western Native Voice and Montana Native Vote have developed their best practices in preventing the spread of COVID-19. We have two public health advisors with us who helped us develop this. Would you guys introduce yourselves?
My name is Lawrence Jace Killsback. I have a master's in public health. I've been involved with tribal communities for a couple of decades now, doing work, program work, government work, and just helping our communities understand the pandemic.
Thank you. I'm Cora Neumann. I have a background in public health, a PhD in public health, and I've been working with rural and Native communities for about 20 years now, focused on access to primary health care. I also worked on the Ebola crisis globally in 2014. And most recently here in Montana, I have been working with the former White House pandemic team to bring support and COVID guidance to Montana leaders, tribal leaders, and state leaders through COVID Local. So really happy to be here and to help review this set of safety guidelines for healthcare workers, but also for the public. So first we want to start just with COVID basics. Even though we've been hearing about COVID for many months now, it's still pretty helpful to go through what COVID is and just kind of a refresher. You'll hear about coronavirus and that it's also, you've heard that maybe it's similar to the common cold. This COVID is not. There are 4 common strains of the coronavirus in the coronavirus family that cause things like the common cold. And then there are other human coronaviruses, like we had SARS, MERS, and now COVID-19. The reason that COVID-19 is so dangerous is because it was transmitted from animals to humans, and our immune systems have never seen anything like it. So we're just really, our systems are trying to adjust to it now, but that's why we have the high fatality rates that we do. The other thing about COVID is that it's highly contagious, especially among certain populations. And there's a risk of really severe disease in elderly, and in communities and individuals with underlying medical conditions such as hypertension, diabetes, cardiovascular disease, chronic respiratory disease, cancer, and obesity. So until our immune systems adjust to this disease, it's going to continue to be really dangerous and highly fatal for certain individuals. Transmission is spread from person to person through small droplets. We're learning as we go. This, again, is a new disease, so even public health officials who've been working with these types of diseases for a long time are learning as we watch this disease spread across through human contact. So people can catch COVID-19 if they breathe in the droplets that have been coughed or sneezed out, or by touching objects or surfaces where droplets have landed. And then, so touching something and then touching their face. That's why you've been hearing a lot about remember to not touch your face. The typical time between infection and the first symptoms ranges from 1 to 14 days, which is another reason that it's so contagious and dangerous, because you may be sick and carrying COVID and not know it. The average of between infection and symptoms actually appearing in someone is 5 to 6 days. And basically almost 100% of people do display symptoms within 14 days. But that incubation period is another reason why this is a hard disease to manage.
So Native Americans experience higher rates of health disparities. We have lower socioeconomic status. That makes us vulnerable to COVID-19 hospitalizations and death, also new cases. The CDC came out with some data, new data showing that we are 5.3 times higher to be hospitalized, 1.4 times higher to die from the disease compared to whites. The information Cora gave really impacts us because, like I said, our communities are still suffering from poverty. We're suffering from trauma. I guess it's almost like the perfect storm for us, and we're just trying to find ways to battle it, and we're relying not only on these ways, but our cultural and ceremonial ways too.
So we're going to go over COVID safety practices, and these can be used within your organization, within your home, within your community. So these really do apply across the board, and so we'll just run through some of the most important things to keep in mind. So one of the things that we've come up with in Montana is this. This is from Greg Holzman. our state medical officer, talks about the 3 W's. To no matter what, the thing you want to remember, even if the information seems to be overwhelming and confusing, no matter what's happening, you want to remember 3 things. Wear a mask, watch your distance, and wash your hands. So why masks? Masks actually prevent the spread by 60 to 80%. They can be uncomfortable and can get kind of hot or uncomfortable to wear them for a long time, but it's absolutely crucial to stop the spread. Watch your distance is because, as I mentioned before, COVID can spread through droplets from your breath, and definitely can travel, up to 6 feet. They're actually seeing that with a sneeze, cough, or singing, coronavirus can potentially spread up to 26 feet. So you really want to take this seriously. It can be hard to keep that distance, but that's without a mask. So that's why it's so important to wear a mask. And then why wash your hands? Certainly you want to wash your hands just in case you touch something that has COVID and then touch your face. But it also prevents you from if you have COVID, from touching a doorknob. It's called fomite or surface transmission. So you have COVID on your hands, you touch, commonly touch surfaces, and it spreads from there to others. So mask, watch your distance, and wash your hands is absolutely number one, no matter what. So just back to washing, just review more in depth what washing your hands means for COVID. So you want to use soap and warm water for at least 20 seconds. So that's why there's something like people have said you should sing happy birthday while you wash your hands. That covers about 20 seconds. Use alcohol-based hand rub, which is something that's at least 60% alcohol. Cover coughs and sneezes with your sleeve or elbow, and avoid touching your eyes, nose, or mouth, which again can be hard, but it's really important to keep down transmission. We talked again about personal space, so you want to keep at least 6 feet of personal space. The other thing that's really, really important especially if you're inside, is to keep doors and windows open. And this can be hard when it's cold or windy, but one of the most important ways to keep down the spread of COVID is to keep ventilation up. And we'll mention that quite a few times in this presentation. So just here, a reminder to mask up, keep us safe. So the symptoms of COVID range from, all across the board, but really the highest, number one, most common symptom is a fever. So coughing and a fever, shortness of breath. It's also pretty common to have loss of taste and smell, headaches, dizziness. You could have any kind of flu and cold-like symptoms. So you want to really pay attention to how you're feeling. And this just gives a sense of the most common symptoms. So that's why if you see here 88% of people display fever, which is why that's the number one way that we're monitoring for COVID. Then it goes down cough, fatigue, shortness of breath, all the way down to diarrhea and stomach problems. The other thing you want to be careful about when monitoring for COVID spread is coming into contact with others who've had COVID or who may have COVID. Not who've had it, but who may have it. So you want to always, if you are monitoring your community and the people you're spending time with, you want to try to ask the questions: have you been confirmed for COVID? Are you currently experiencing any symptoms? So even if you haven't been diagnosed with COVID, do you have fever, cough, or shortness of breath? Have you been in close contact with anyone with COVID or anyone with acute respiratory illness? So this is just, keeping up to date with your friends and close contacts, how they're feeling and if they've come into contact with anybody who's had COVID.
So if you are feeling those symptoms, we're recommending most organizations or businesses will tell you to stay home, don't go to work, call your supervisor, seek healthcare providers. This applies if you are also around someone who's exhibiting symptoms. Staying safe at home. Multi-general households usually are difficult to talk to, and so we're asking that there's isolation that occurs, ways to limit that. We practice the 3 W's, of course, and that's at home. And we want to stay home and away from crowds. It's possible to have, you need to at least try to have a supply of 2 weeks of medication supplies. We know we're working with different groups on different reservations to ensure that there are medications or supplies for those quarantines to occur. We'll be able to get you guys a list of those contacts. When there's a need for a house to go to the store, try to choose 1 or 2 persons to be sort of an errand runner. And these persons can go to the store. They can use the one vehicle and really help prevent the spread. Turn it back to Cora.
So the other thing about staying safe at home, it can be really hard if you have many people living under one roof, but there are ways to stay safe. It's difficult, but there are ways to stay safe, and there are many communities that do have, if someone is sick, additional facilities for that person to go and stay in, so that they can stay safe and keep their family safe. Regarding childcare, this is something that comes up often. Elders and people who have underlying medical conditions such as diabetes or serious heart conditions should avoid caring for children. Children can have high rates of carrying COVID and not displaying symptoms, and so we just try to really be aware of the rate of spread among children. If someone is higher risk and must care for children in the home, those children should not have contact with people outside the household, which again can be really challenging, but these are the best practices right now. If you're isolating or caring for a sick member of the household, as much as possible, provide a separate bedroom or bathroom for that person that's sick. And if that's not possible, just try to do your best to create separations throughout the house. And Jace will go over this a little bit more in the next slide, but you want to designate one person to take care of the person who's sick. Avoid hugging, kissing, sharing food, avoid sharing towels or other household items until they've been washed, and really have the person who is sick wearing a mask inside the house as much as possible. The other thing you want to make sure to do is, again, keep doors and windows open, and Jace can go over this a little more.
So if you need to share a room, again, we want ventilation. Ventilation has been sort of the way we prevent the spread, or really control the spread. And that, again, is weather permitting. We want to keep, beds and other furniture 6 feet away as much as possible. This is for the home, but also we'll get into the offices, that there's some engineering controls you can do, like physical dividers, shower curtains, plastic, cardboard. If you need to share a bathroom, it's good to have the disinfecting and the cleaning products available for high-touch surfaces for people to use before and after. And we really just want to encourage that it's not something to really feel like you're imprisoned with. It's something that we're all going to have to adopt, and we're all going to have to really understand that we're going to be cleaning and disinfecting as much as we can. This is whether we have it or we don't have it in our homes. So that's another way to think about it.
Yeah, and as we head inside more, as the weather gets cold, this is going to become more and more important because it's going to be harder to spend more time outside. The other thing that's coming up across communities all across Montana is mental health and wellness. Actually, not just Montana, the whole country is really suffering from the impact on their mental health and wellness through COVID and isolation and separation. Social distancing is making a lot of people feel isolated, which is leading to loneliness, depression, and poor health. Suicide rates are up. And so it's really, really important that we stay conscious of the impact of this on our mental health. So these are just some tips for managing COVID stress: taking breaks from watching, reading, or listening to the news. Hearing about COVID all the time, around the clock, or politics right now can really get people down, can be upsetting. So take breaks, take care of your mind and body, take deep breaths, meditate, stretch, do whatever it is whatever practices help you center and sort of reduce stress. Exercise is hugely beneficial for mental health. So anything you do in and around your home, sitting outside, getting sun, vitamin D is critical for mental health and for wellness. Just, some real basic tips about eating healthy as much as you can, sleeping, limiting alcohol and drugs, and really just making sure to reach out and connect with people, even if it's, via phone. Just stay connected with your community.
That's the other thing I wanted to mention about the mental health, especially for our tribal communities. I know that our people are seeing it sort of a different way. There's a lot of shame going on in our communities, and that's something that we're trying to address. That it's nothing to be shameful that you've caught COVID-19 or your family has been exposed, and we really need to open up that line of communication on what we're going through and how we're going through it with the disease if we happen to contact it. So that's just another thing to think about. And always one of the better ways to deal with this is is to smudge. Sweat lodges, it's good for you to do it with your own family, but having a community sweat lodge or other people partake should be limited, because that's another way that it could be spread. So that's also another recommendation I wanted to add there for the mental health piece.
Yeah, and we saw this, just another quick note on that, we saw this with Ebola as well. There was a lot of shame and fear, especially when there's a lot of miscommunication or misunderstanding. And so, you know, one of the things that we recommended for Ebola and for COVID as well is that really if you can share that you have COVID, or if you have COVID and isolate, you're actually really a healthcare hero. You actually become someone who's protecting your community by getting tested and staying safe. So I think one of the things that we talk about is just to actually even be proud of the fact that you're able to help protect your community.
Yeah, healthcare warriors, which leads us to this, equipping our team and communities.
Go ahead, Jace.
So the PPEs, we hear that a lot, the personal protective equipment. I had to Google it. No, I'm just teasing. But disinfectant wipes and disinfectant spray, these are standard. Hand sanitizer, at least 60% alcohol. Masks, face shields, those are good to wear together, the mask and the face shield if you have those. That's really if you're doing work or going into the field, but also gloves. The thing about gloves is they need to be viewed or used as if you're not wearing gloves, meaning they should be sanitized or washed if you're frequently touching surfaces, because they can still hold the disease and transmit it.
Yeah, you don't want, gloves can give a false sense of security, so you want to make sure that you continue to sanitize them even if you're wearing them.
So the infrared temporal thermometers are what most organizations and most groups are using. In taking temperature, we just want to remind you that you want to keep as much distance as possible, wear a mask. That's you and the individual getting their temperature taken. Wash your hands, use gloves. The important note here is the 100.4 temperature threshold. Anything at that level and above is considered a fever. They should go home. They should seek medical attention, and do not make further contact with them. Homes and offices. We talked about homes earlier, but offices, ventilation. Cora mentioned that's really a key component there in the prevention and spread. So the EPA does make some recommendations that these are effective, but only effective to reduce air pollutants and viruses if you're practicing the CDC recommended best practices, meaning that these portable air filters and cleaners aren't a silver bullet for the homes or offices. They need to be used with best practices of good hygiene, wearing a mask, and social distancing. Most groups, most organizations now, tribal governments have been going to virtual work and Zoom meetings like we're doing here with the trainings, so that those can be conducted by video. And so if you guys need help with that too, the organizations that we're representing also help with the Zoom meetings and setting up the virtual conferences and webinars. The idea, there is a distinction, is to clean first and then disinfect. You want to use soap or detergent to clean visible dirt and grime, and then you disinfect the area. Most products will say 3 to 5 minutes to let dry. That's how disinfectants work. They have to do their work and then dry, and then they're most effective on clean surfaces. Disinfectants, the ones that we are using or supplying with our organizations or working with organizations with, are all approved through the EPA, and they're on the list. There's a link down there, but you guys can Google that EPA list. The most recent addition to that was pine saw. Who knew? Indians knew the whole time that was a disinfectant. Safety measures for these disinfectants are going to be on the labels. Just watch them, read them, follow the precautions, wear gloves when you're cleaning, take off the gloves and wash your hands. Again, we're reiterating the 3 W's, but washing your hands after cleaning is going to be key. Also, don't just think because you're using a product that disinfects that it's going to clean or disinfect what you're on your hands. You want to also wash your hands. Excuse me. Oh, everybody's trying to say COVID cough there, right? Cleaning and disinfecting high-touch areas, doorknobs, lights, handrails, kitchen appliances, handles, things that touch food, elevators. Most of these are for shared areas, and we know at home it's a lot different. But again, if we are having to quarantine somebody, it's good to clean these high-touch areas where a lot of people are using phones, printers, keyboards. In offices, it's going to be your conference rooms, your office chairs, and your restrooms. You want to clean those frequently. Vehicle safety use. We are definitely encouraging single-person travel. If you have to travel with 2 people, one in the back, one in the front, always wear a mask. Limit your time in the vehicle. That doesn't mean speed, but also you want to have the windows open. And if you are able to, and weather permitting, keep those windows open so the air is flowing through the vehicle.
Yeah, even on the highway.
What's that?
I said, even on the highway, it might be uncomfortable, but you'll keep hearing me say ventilate, ventilate, ventilate.
Yeah, it is. It is. You might have to turn up your radio a little bit higher, but it does give you a peace of mind too to feel the air, go through the car and breeze hit your face. Hand sanitize before and after entering the vehicle, and again the high touch areas on the vehicle. The COVID safety policies. Again, these are important for work in the state and work in our tribal communities. Montana is currently under phase 2, and we've been under that for a while now. But we need to be aware of the COVID positive tests, the new test cases, and the Department of Public Health and Human Services has a daily announcement and notification for those numbers. So we want people, and especially those in the field and those working, to be conscious of that. Get a link, get that update on your social media. Tribal governments and tribal programs.
Jason, I'm going to interrupt you for a sec. I just want to, so right now we are at the end of September, and COVID cases in Montana have been higher, like the case per day has been higher in the last couple of weeks than the highest so far. And so we're still in phase 2. I don't think we'll go back into, full shutdown, but it is continuing to grow and spread pretty quickly. So even though we've been in this for a long time and have been trying to stay safe for a long time, we're still very much in the middle of it. And in fact, the rates are higher now than they have ever been. So it's going to be, we're going to be riding this out for many months to come.
Thank you for that. So again, tribal governments and Native organizations and programs are recommended to develop and implement a COVID safety policy. Some of these may be standards for your funding agencies. We know that off reservation, those are going to be key to legal protections, but also for safety of not only the workers in your programs or your organizations, but the families that they're coming from. So tribal governments have their own stay-at-home orders, their own rules and regulations. They have tribal sovereignty that allows them to do this. And most businesses, vendors, even our organizations require their authority, their permission to conduct our work on their lands. So that's one thing we need to keep in mind when working with our tribal communities. Organizational policies, this is an example. Western Native Voice and Montana Native Volt both developed a joint COVID-19 policy back in March when the pandemic hit. And again, they really wanted to make sure that they are insulating and protecting the organization in its work. They want to make sure that they have policies in place and protocols to follow for their employees that are doing work. They want to protect their employees' families, but most of all, the communities they're working in. They do not want to be a conduit for the spread of COVID-19. So most organizations, if they have developed these, most of them are going to be about reporting symptoms, reporting positive tests, and being prepared to enact self-quarantine. They want to also have organizations, tribes look at their healthcare benefits, and also to look at attending trainings on COVID plans and policies. Administrative responsibilities, directors and managers, the leaders of our organizations and groups really need to be conscious, need to educate themselves and become really sort of experts on this. And if not, there's public health advisors or consultants you can work with. You can team up, and your own local public health authorities also give this information out. But they can train your staff. They can give you template policies and plans that you can adopt, and they can help you perform some COVID hazard assessments. That's to see how safe your situation is, your work environment, your reopening plans, if you will.
Can I chime in there, Jace, just real quick? So on the, yeah, one of the things that I mentioned at the beginning was the COVID local team. So if you want to find model policies or understand metrics for reopening, COVID local is a team that has put together a whole set of tools, and it's at covidlocal.org. We can share that on the website, et cetera. But that's another place where if you feel like you need to get a model policy or understand how to make decisions around reopening or shutting down, there are some great tools out there, and we're here to help share those with you.
Thank you. The other, I guess, important issue that's been brought up is leave, sick leave. So the Family First Corona Response Act guaranteed 2 weeks of paid sick leave, and this lasts until December 31st. This also impacts those who are affected by school shutdowns or childcare issues. So if your organization hasn't looked into that policy or that law, check out the mandates there. They're pretty straightforward. Most organizations and most tribal governments have adopted those, but look at the particulars for your HR and your payroll people. Communication, again, is going to be important. Communication is key in all of this, if you're at work or if you're at home, but this is geared towards work. You want to be conscious of your standards in which community you're in. We're mostly working with Native communities, so your tribal government standards, those may change, but try to find out and try to be on point with those changes. Most social media platforms like Facebook or Instagram will have tribal government links that constantly update those. So be aware of those. Set communication standards at work so that there's requirements for reporting. There's requirements for any positive test case, those type of things.
And you can even set some policies for your home and community. My grandmother's 94, and we have quite a bit of family around, and so we have our own, and within our family, our own set of rules that we all agree on. So that applies to work, but you can also have that apply to your household and to your community. So managing COVID exposure, certainly, at some point in time over the course of this year, every single one of us is going to be exposed in some way to COVID. And so it's really important to think through how to manage that and how to respond in a way where, not to panic, but to figure out how to take the right steps to stay safe. So if an individual or employee, and again, we're doing this for communities and for institutions, so when an individual or employee exhibits COVID-19 symptoms, he or she must immediately seek a COVID test, and we'll continue to try to share updates on where testing is available. If no test is available or results are delayed, which again, we're also seeing, the employee or individual must remain home until at least 10 days have passed since the symptoms first appeared, and 72 hours have passed since the last fever without the use of fever-reducing medicine. So this really applies across the board. So then the next step would be then if you feel sick, you go and get a test and you are COVID-19 positive. You want to self-quarantine away from work or others, and you can, we covered earlier how to manage quarantine and isolation. Individuals or employees that test positive and are symptom-free may return to work or leave quarantine when at least 10 days have passed since the date of his or her first positive test, and they have not had a subsequent illness. Now, obviously, we are not your doctors, so certainly follow your doctor's guidance above ours always, but this is the standard protocol right now. And employees who test positive or individuals who test positive and have been hospitalized may return to work when directed to do so by their medical care providers. And then finally, if you've been in contact, and this is where contact tracing comes in, and we'll go over that next, but if individuals or employees have come into close contact with an individual who's tested positive, a coworker or otherwise, they would also be directed to self-quarantine for 14 days from the last date of close contact with that individual. And close contact is defined as being within 6 feet or closer for a prolonged period of time with someone who has COVID-19, or of course, if they live in your household as well. So contact tracing is really a way to help slow the spread of COVID-19 because it's so highly contagious. Contact tracing helps you protect your family and your community by letting people know that he or she may have been exposed to COVID-19 and should monitor their health for signs and symptoms of COVID-19. Helping people who may have been exposed to this is also part of contact tracing, is also helping people who may have been exposed access testing. And so contact tracing is recommended and required by public health departments across the state. Confidentiality, I don't know if Jace, if you want to take this one, but confidentiality and privacy are really very, very important. I know to Western Native Voice and Montana Native Vote, sorry, and to most institutions and organizations, because privacy above all else, really keeping people safe and keeping their medical information safe is really important. But why don't you go ahead and take this one?
Yeah, I know. Back at home here on Northern Cheyenne, everybody's like HIPAA, and that's the Health Insurance Portability Protection Act. Really, that's geared towards healthcare centers and those who deal with health information that's protected. But when it comes to organizations, I think really it has to do with privacy. Privacy is about you and your own privacy versus confidentiality, which is also important, which is keeping your information confidential. So our organizations have the commitment to keep all information related to COVID and even your medical information private and confidential. Now, if you're exposed as an employee or happen to test positive, your name won't be shared with anybody. But also, if you want to inform your coworkers, then we're requiring consent. Consent that we can share your health status with your coworkers or the public. Now, those standards should be the same across the board for your communities and your institutions and your organizations. But check on those and ensure that we don't want to again have any your protected healthcare information out in the public. Really, this is what we've developed for our staff that go out in the field, and we wanted to make sure that it was available for communities and other organizations. We're also available to help, develop specific guidelines for tribal communities and organizations that might not have resources. Myself, my phone number's on here. So is Dr. Cora Neumann, and we're available for your guys' questions and concerns. And anything we can do to improve our work too, we're open to.
Thank you so much. And thank you, Ronnie Joe and Western Native Voice. I keep doing that, Western Native Voice and Montana Native Vote. Thank you for having this and for offering this to communities. I just want to say, above all else, remember the 3 W's: wear a mask, wash your hands, watch your distance. And we're also going to be having weekly Facebook Live question and answer sessions on Tuesdays at 10 a.m. every week, just so that people can come on. Maybe you've watched this and you have additional questions, or you want more help for your institution or your household. We really just want to be available to answer questions, because we know that this is a lot of information changing quickly, a lot of fear and miscommunication at times. And so we're here to be a resource and to really support your communities to get through this healthy.
Thank you, guys.
Thank you.